hello. You're kind of like in my bubble there. So you're here to see the dentist. No shit. It is a dental clinic, alright? Or you didn't know that? Really? Anyway, do I know you from somewhere? Like, were you at Ashley's party last week? You look really familiar. Are you the girl that was throwing up in the bathtub? Oh, I'm sorry. Whoops. Anyway, never mind the hair. I'm having a bad hair day, okay? Just don't look at it if you don't like it. Anyway, my name is Maxine. I am the dental receptionist. No, I am not the dentist. Do I look like a dentist? Like, I am way more beautiful than her. Alright? Let's get that straight. Anyway, I'm just gonna take your name and shit or whatever. Are you a previous client? Yeah. Well, you don't have to do the questionnaire and all that stuff. So what's your name? And your last name? That's a weird last name. Where the freak are you from? Okay. Sorry. What's your phone number? You can't even remember your own phone number? You have to look it up on your phone? Really? Obviously, not many people ask you for a phone number. Okay, what is it? Okay. Are you sure? Okay. Okay, so, and what are you here for today? A cleaning? Anything else? Well, you do have a big ass lump on your face, so I think it's more than that. Okay. And for a checkup to see what that big ass lump is on your face, alright. Alright, that's it. And you can sit down and wait until I call your name. Alright? Okay, goodbye. Hey, welcome back. It's great to see you again. How have you been? That's great. So the receptionist told me that you're here to get a teeth cleaning. Yeah. Any other problems or anything? Okay, you got a bit of, I see a bit of swelling there, right here. Yeah, having a lot of pain, can't sleep. Okay, have you noticed any decay or cavities or anything like that? No? Okay. Well, that's perfect, but not perfect in the sense that you're having pain, but it might be a simple fix. Any sensitivity or anything like that as well. Yeah. Alright, so after our cleaning, I'll just take a x-ray and we'll see what it is, okay? Perfect. So I noticed last time when you were here for the first time, on your chart you said you have anxiety, really bad anxiety, and like a phobia when it comes to the dentist. Yeah, how was your last visit? Did you find it a lot better than the previous dentist you went to? That's good to hear, because here we try and relax people because we know a lot of people hate the dentist. So we want to make it as positive of an experience as we can. So that's great news, and hopefully today again we can make it super relaxing. Alright, perfect. So I'm just gonna grab my tools and then we'll get started with your cleaning today. So sit back and relax and we'll get into it. Sound like a plan? Okay, perfect. So I'm going to show you the tools that I'll be using today. So I got 4 different tools, and one is kind of obvious. It's just this normal toothbrush. We like to use these at the dentist because they're very disposable, and it would be kind of expensive to use the fancy ones, the battery operated ones. But if you're using one at home, we definitely recommend you get one of the battery operated ones because they do a way better job of cleaning your mouth. So we just have that normal toothbrush, this little thing here, which is a tongue cleaner. It's crazy. A lot of people don't realize, like, it's also important to clean your tongue because it holds a lot of bacteria. We have this little mirror guy here. That's just to check your teeth because it's hard to see, like, from just looking in. We use this mirror so we can see all around. And then we have this double-sided. It's a plaque picker for getting the plaque out of your teeth. So that's everything that we're going to be using. So just sit back and, if you can, open up your mouth for me and as wide as you can. If you feel like you need to just take a breath or anything, just let me know. Or if you want a break because your mouth is getting tired, just let us know as well, okay? Okay, perfect. Okay, so open as wide as you can, and I'm just going to check around for any cavities, any signs of decay, any signs of periodontal disease, any gum disease signs, any bleeding gums, any red swollen gums. There's so many things we'll be looking for. Okay, so everything looks pretty good up top. Let's check down the bottom. Okay, so right down in that back corner on your back molars, it seems like there's a lot of swelling. Looks to be infection there. It's really sore looking, but it's behind your molar. So I'm guessing that that is a wisdom tooth. That maybe it's impacted. we'll have to take an x-ray of that one later. But I would assume that it's impacted and it might have to come out. So if you're willing to get one taken out, I would definitely go to an oral surgeon and get all 4 taken out, because the other ones are probably just going to cause problems too, where we don't really have enough room in our mouth for them, and it's hard to reach if we keep them, so they end up getting pulled anyway. So I would definitely recommend getting all 4. Okay, so now I'm just going to use this plaque picker to check your teeth and call them out to my assistant, the condition of them, and then we'll use it to get in between the small spaces of your teeth and make sure all the plaque and the food is out of your mouth. Okay, so open wide. Three, 5. 3, 5, 3, 5. 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, 3, 5, 3, 5, 3, 5. 3, 5, 3, 5, Okay, take a breather. And now we're just going to get in between your teeth and kind of scrape the plaque away. Some people get really sensitive after this is done, but it should go away within a day or so. So don't be too worried, but it may cause some sensitivity. Alright? Okay. So are you excited for winter? No, not so much. Me either. I don't really like the cold, although it's alright sometimes. I find it's really hard to wake up in the mornings when it's cold outside because you're so cozy in bed and you don't want to move. I'm not seeing too much plaque. Your mouth is overall healthy. So any plans for the winter or Christmas time? Yeah, it's pretty crazy out there. Everyone trying to get everything done. Are you done shopping? No? You're a last minute shopper? Yeah, a lot of people are. See, my problem is that I have stuff for people, but then I go out and I'm like, oh, this would also be good for them. And then I can't stop shopping. let me know if this hurts or anything. Okay, looks good. Okay. So now I'm just going to brush off your tongue. Can you stick out your tongue for me? Yeah, I know it's kind of silly. Alright. Yeah, it always feels really weird when you clean your tongue. It's like a weird thing to clean, isn't it? It holds so much bacteria though. Okay, so you want to take some water and just spit to the side if you want. Yep, there's a sink right there. Okay. Get all that extra gunk out of there. Okay, so now I'm just gonna brush your teeth. Gonna get some toothpaste. Okay, and I'm just going to brush. You wanna brush in circles and for at least 2 minutes. So, circle motion all around. Yeah, it's really weird when someone else brushes your teeth. I get that a lot. This toothpaste is all natural. We usually don't go with like the generic brand stuff. You never heard of it before? Well, we have some sample sizes of it if you want to try it out. It's great for your teeth. It doesn't have any of those harmful additives that actually damage your enamel. Speaking of enamel, do you grind your teeth at night? Because the bottoms of your teeth are very light, so that means you have been grinding at them, possibly in the nighttime without noticing. It can cause a lot of problems for your teeth. They can get really fragile and crack off. So I would definitely suggest getting like a mouth guard for the nighttime, so when you're grinding, it protects your teeth. Okay, perfect. So we're just gonna take some x-rays now and see what's on the go with that back tooth, okay? Have you had x-rays before? Yeah? Okay. Well, you know how this goes. Perfect. So I'm just gonna step behind, pull out the machine, and take some x-rays, okay? Alright, perfect. Okay, so I'm just gonna take a few x-rays. All I need is a couple. So are you ready? Okay, perfect. Okay, perfect. You did excellent, and we'll see what comes up, okay? Sit tight. Okay, so looks like you have an impacted tooth in the back here on the right side, and your tooth is going this way. I can show you the x-rays if you want to see what they look like. Yeah, okay. So this is what it looks like right here. As you can tell, that the back ones are impacted and they're going into the other teeth. So that's gonna cause some pressure and pain. So yeah, it looks like you're going to need a oral surgeon to remove that one tooth because it's too complicated for us to remove. So on your way out, you can get the receptionist to possibly book it for you if you want. It's usually a long wait, like 3 to 5 months. So yeah, it's a pretty long time. They might put a rush on you though, where your tooth is infected. I'll give you some antibiotics to help with the infection, but for them to put you in faster, you usually have to go through 2 infections, I think, to be put on the immediate list. Other than that, it's 3 to 5 months, I believe. Yeah, I know. It's really hard. I know. I went through the same thing. I know your pain. The surgery is nothing to it, especially when you're put out for it. It's like you fall asleep and then you wake up at home. Nothing to it. Okay? So I guess I'll see you back here after that, since everything else looks really good. And we'll see how your wisdom teeth are healing up. Your gums are healing up afterwards, okay? Alright, so that's it for now, and I'll see you at your next appointment. Have a great day.